The title of this podcast is Behind the Robot: The Hidden Risk of Robotic Surgical Instrumentation in Sterile Processing. Welcome to Behind the Robot, the podcast where we explore the critical role of sterile processing in modern surgery. Hello, everyone, and welcome to Behind the Robot. Today, we're discussing one of the fastest growing areas in surgical instrumentation: robotic surgical instrumentation, specifically systems like the Vinci surgical system. Robotic surgery has revolutionized minimally invasive procedures. It allows surgeons increased precision, smaller incisions, and shorter recovery times. But behind every successful robotic surgery is a sterile processing department responsible for cleaning, inspecting, and maintaining highly complex instruments. While robotic surgery improves patient outcomes, improper cleaning, inspection, and handling of robotic instrumentation in sterile processing significantly increases the risk of surgical site infections, device malfunction, and financial loss, making specialized SPD training and strict IFU adherence essential. Why robotic instruments are different? Robotic instruments are far more complex than traditional surgical tools. Unlike standard forceps or scissors, robotic instruments have multiple internal joints, contain cables and moving wrist mechanisms, include insulation layers, and have limited use life cycles. They're often only able to be used about 10 times. For example, the Da Vinci instruments track usage electronically and lock after a set number of uses. The problem is because these instruments are intricate, bioburden can hide in microscopic crevices and internal channels. According to the Association for the Advancement of Medical Instrumentation, failure to follow IFUs is one of the leading causes of sterilization failure. If an internal debris remains, steam may penetrate effectively, sterilization may be compromised, and infection risk increases. The main issue is cleaning failures. The biggest issue with robotic instrumentation is improper cleaning before sterilization. The Association for the Advancement of Medical Instrumentation clearly states that sterilization cannot compensate for inadequate cleaning. If tissue or blood remains, biofilm can form, microorganisms can survive, and the sterility assurance level cannot be achieved. Common mistakes include skipping pre-cleaning steps, not flushing lumens properly, using incorrect detergents, overloaded ultrasonic cleaners, and ignoring visual inspection failures. Research published in the American Journal of Infection Control shows that complex instruments have higher contamination retention rates if manual cleaning steps are rushed. In Section 3, we will discuss financial and operational impact. Robotic instruments are highly expensive. A single robotic instrument can cost between $700 and $3,500. Improper processing can result in instrument damage, failed cycles, case delays, replacement costs, and hospital liability. Additionally, surgical site infections increase patient safety and cost hospitals thousands of dollars per case. The Centers for Disease Control and Prevention estimates that SSIs are among the most common healthcare-associated infections. So this is not just a technical issue, it's a patient safety and financial sustainability issue. Solutions and best practices include strict IFU compliance, dedicated robotic teams in the sterile processing department, enhanced visual inspection, limited IUSS for robotics, and ongoing education. We will touch all of these bases, starting with strict IFU compliance. Manufacturers design robotic instruments with very specific cleaning instructions. Skipping even one flushing step can compromise the process. Facilities must have easy access to digital IFUs, train staff specifically on robotic trays, and perform annual competency validation. Dedicated robot teams in the sterile processing department. High performing facilities assign specifically trained technicians to robotic instrumentation. Why? Because repetition builds expertise. This reduces errors and inspection failures. The third reason is enhanced visual inspection. The use for this is lighted magnification, borescopes for internal inspection, and installation testing equipment. Many facilities now require magnification as standard practice for robotics. Reason 4, limited IUSS for robotics. Immediate use steam sterilization should rarely be used for robotic instrumentation due to complexity and required drying times. Robotic trays are not ideal for rush turnaround. Reason 5 and final reason is ongoing education. Continuing education through AAMI guidelines, industry webinars, and certification programs such as CRCST. Ongoing education ensures technicians stay updated on evolving robotic platforms. Real-world case scenario. Let's consider a real-world example. A hospital performs multiple robotic procedures daily using the Vinci surgical system. Due to high case volume and pressure for fast turnaround, robotic instruments are rushed through decontamination. During an internal audit, staff discovered retained bioburden in the wristed joints of a robotic needle driver. Further investigation reveals incomplete brushing of internal components, failure to flush lumens according to IFU, skipping magnifying inspection, and overloading ultrasonic washers. While no infection was directly traced back to the instrument, the hospital had to pull robotic trays from service, cancel scheduled procedures, conduct staff for training, report findings to risk management. This example highlights something important. Sterile processing department errors often go unnoticed until they don't. Unlike visible surgical complications, sterilization failures may not present immediately. That is why traceability and documentation are critical. Regularity and accreditation. Expectations. Facilities are not just encouraged, they are required to meet standards. Organizations such as the Joint Commission, Association for the Advancement of Medical Instrumentation, and Centers for Medicare and Medicaid Services expect healthcare facilities to demonstrate documented sterilization cycles, load traceability, IFU accessibility, staff competency validation, and quality assurance monitoring. If robotic instruments are not processed according to manufacturer's instructions, facilities risk accreditation citations, financial penalties, increased liability, and reputational damage. Surveys frequently request to see IFUs for complex devices. If sterile processing department staff cannot produce them or explain the cleaning steps, that becomes a major compliance concern. The hidden risk of installation failure. Another critical issue with robotic instruments is installation failure. Because robotic instruments are electrical energy, damaged installation can cause stray energy burns, internal issue damage, and patient injury. Installation defects are not always visible to the naked eye. This is why many facilities now implement routine installation testing, magnification during inspection, removal of instruments at the first sign of cracking. This step protects patients from surgical burns that may not be immediately recognized during the procedure. Robotic technology increases precision, but it also increases responsibility. The future of robotic instrument processing. Robotic platforms continue to evolve. Newer systems aim to reduce instrument complexity, improve cleaning accessibility, and increase reusable lifespan. AI is also being integrated into tracking systems to monitor instrument usage, predict repair needs, and track sterilization history in real time. However, technology alone cannot solve processing errors. The futures of robotic surgeries depend heavily on skilled sterile processing professionals, strong communication between OR or the sterile processing department, ongoing education. As robotic surgery expands into general surgery, gynecology, urology, and cardiothoracic procedures, sterile processing departments must be prepared for increased demand. Robotic surgery represents the future of healthcare, but it depends heavily on sterile processing professionals. Today, we discussed how robotic instruments are complex than traditional tools. Improper cleaning improper cleaning creates infection risk. Financial and patient safety consequences are significant. Strict IFU adherence and training are critical. A key takeaway from this is that technology does not replace sterile processing. It makes it more important than ever. Behind every successful robotic surgery is a technician who cleaned, inspected, and sterilized that instrument correctly. This podcast script was developed with brainstorming and formatting assistance from ChatGPT. All content was reviewed, edited, and supplemented with course knowledge to ensure accuracy and alignment with sterile processing standards.